We're here today to listen to the ideas near and dear to the hearts of rural America, more specifically to discuss policies to keep high-quality health care accessible in rural communities.
I think it's much earlier in the educational process that we need to get to these students, not only with a marketing plan for why it's great to practice in rural America, Iowa specifically, but there's an opportunity to do better from a compensation standpoint, because we have got to, from a policy standpoint, begin to identify this disproportionate difference between what we pay the cognitive specialists, our internists, our family practitioners, compared to what we pay our proceduralists is wrong.
When we talk about rural, you'll talk about recruiting people to rural Des Moines, okay? We're talking about recruiting people to rural Redfield and rural Pocahontas and rural Sac City. There's a difference. There's a different degree of rural, and people don't understand that really when you're sitting in Washington or wherever and say, hey, we got people to Des Moines, things are working great, or we got people to St. Louis, that's pretty rural. That isn't rural, okay? That isn't what we're talking about today.
Beyond the lack of access to specialty care, some rural communities are facing the stark possibility of having no health care services available in their county whatsoever. In the most plain-spoken terms, I'd like to share a message to these rural communities: not on my watch.
Just because you choose to live in rural Iowa, or rural Utah, or wherever it may be, Montana, Minnesota, South Dakota, should your expectation of health care be any less?
It's about more conversation and more communication.
I'll continue to leverage my leadership assignments, champion innovative solutions, and raise my voice to education policymakers and lawmakers in Washington. And that simple message is rural health matters.
I just want you to know that in coordinating care with rural facilities and with senior facilities, you can really save lives, and I'm living proof.